The federal government announced more funding for testing and contact tracing earlier this week. The Prime Minister adding there could be a second wave and Canada needs to be prepared. For more on this, we're going to bring in Dr. Raywat Deonandan. He is with the University of Ottawa. Thank you so much for coming on the show. I just want to talk about contact tracing, but first, those scenes at the parks in Toronto, those crowds we saw clearly not 2 meters apart. What was your reaction to that?
It was upsetting. It was upsetting, and all I can say is I fully expect in 2 weeks to see an uptick of cases. It's upsetting for a number of reasons. Number one, it's for all the work we've done in the last few weeks to drive our case numbers down, to be flagrantly flaunting the public health orders is just irresponsible. So I don't know what more to say than that, except it's disappointing.
Absolutely. Shocking scenes that we saw both in Toronto and some here also in Gatineau and Ottawa. How important is testing and contact tracing, especially in light of provinces beginning to reopen and, of course, the scenes that we're seeing with this nicer weather?
It's everything. So we call it TTI, testing, tracing, and isolation. It's really the only tools we have going forward to get a handle on these outbreaks before they become epidemics. So the idea is to be able to identify those little embers before they become wildfires. So if we can expand our testing regime to get the asymptomatic cases, then descend upon them with overwhelming public health might and do contact tracing and get a sense of who has been exposed and then isolate those people, we can prevent those handful of cases from becoming outbreaks and prevent outbreaks from becoming epidemics. So in coordination with the contact tracing and the testing and isolation, we also need the cooperation of the citizens to do their part and physically distance. This only works if everyone does their part.
Right, and the challenges that we have now when we're seeing big groups and people slowly start to emerge, the challenge to contact trace thousands of people.
Yeah, that's a big deal, and we haven't got really the manpower resources to do this right. In China, near the end of their first wave, they had to employ several thousand teams of 5 epidemiologists each to do contact tracing. We don't have that capacity in this country or province, so we're going to have to rely on technology, the new tracing apps, for example, to help us out. Now, the tracing apps are not a silver bullet. They aren't going to solve everything, but they are just a tool, and they come with a hefty price in terms of civil liberties. So going forward, there's going to be, again, an enormous amount of public buy-in to do this right, for everyone to be compliant with the public health rules and to agree to be traced. Otherwise, we're all going to be possibly having to be locked indoors again for the second wave.
And quickly, final word here, how prepared do we need to be for a second wave?
We have to be very prepared, and we can avoid a strong magnitude second wave if we do all these things correctly. Further waves are inevitable, but what isn't inevitable is that they have to be huge and disruptive to our lives. That's why it's critical that we make the investments now to tracing and testing, and again, physical distancing.
Okay, Dr. Deonandan, thank you for this. We'll talk again soon. Stay safe.
Thank you.